Hello, I'm Avery Davidson. Thank you for joining us. Michael Dana is on assignment this week. Not much of a holiday week for folks over in Washington, D.C. Lawmakers are still hashing out the details in the more than 2,000-page Senate health care reform bill. It would reportedly extend coverage to 94% of eligible Americans. But what does that mean for rural Louisiana?
Well, it's going to affect them two ways. One, of course, it affects them personally because they all buy health insurance as well, and most of them buy individual policies unless spouse works at a place that provides health insurance. Then it also affects them as an employer. So many of them hire seasonal workers, particularly during harvest and planting season, that help them during the year, and how that affects them could have a large economic effect as well.
Regardless, the cost of health care already has a large economic impact on farmers. According to a 2007 survey, the average farm family spent nearly $8,000 a year on health insurance premiums alone. That does not include the money they spent on doctor copays, prescriptions, and how much they had to spend to reach an already high deductible.
The biggest issue that we have in healthcare today is the cost.
Gil Dupre is the Chief Executive Officer of the Louisiana Association of Health Plans. His group supports health care reform, but not in the way proposed by the Senate bill. Dupre says the bill currently before the Senate sets limits on how much older folks can pay for health insurance coverage, that it can't be more than twice what younger people pay.
We need to get more younger people enrolled, but the effect of this is going to be to make rates go up at a disproportionate rate for the very younger people that we need to get into the system.
So there are going to be some tax increases here which are going to get factored into the rates. So it's going to be hard to tell exactly how all this is going to work out with the ongoing inflation and rates and that sort of stuff. I think we're pretty confident the rates are going to continue to increase no matter what.
Monroe says the Louisiana Farm Bureau has not taken a position on the current health care reform bill, but says the current proposal may not be the best.
I think it could be better approached. I think what's going to happen is it's going to cost a lot of money. It's going to cost trillions of dollars over a period of time. The cost of this bill, depending on it's the House bill or the Senate bill, in round numbers is $1 trillion over 10 years. They offset that somewhat with tax increases, but you pay me now, you pay me later. It's going to cost an awful lot of money to taxpayers in order to do what these bills pretend to do.
Louisiana Senator Mary Landrieu voted in favor of bringing the bill up for debate, but only after Senator Harry Reid amended the bill to include $100 million for Louisiana's Medicaid program.